All right, my name is Andy Miller. I'm with Georgia Health News and Kaiser Health News, and we're here to talk about the latest surge in COVID, which is driven by the Delta variant. I want to first of all thank the media representatives who are here, and we also want to thank the Mercedes-Benz Stadium, which is hosting the event. We note that the two teams that play there in the stadium behind me, the Atlanta Falcons and the Atlanta United, are both 100% vaccinated in terms of their players, and we know that that's the most concrete way to fight this virus, and we appreciate Arthur Blank's commitment to getting employees vaccinated. We have a distinguished panel that they're each going to come up and talk about what they're seeing on the front lines of the pandemic. And I'm going to introduce them, and then they're going to come up to the panel, come up to the podium one by one and tell us what they're seeing in their facilities. We're going to hear from Dr. Danny BRANSTETTER, who's Medical Director of Infection Prevention at WellStar Health System. Dr. Jim FORTENBERRY is the Chief Medical Officer for Children's Healthcare of Atlanta. Dr. SHARON PAPPAS is Chief Nurse Executive for Emory Healthcare. Dr. Andy Jafal is Chief Medical Officer for Piedmont Atlanta. Dr. Robert Jansen, Chief Medical Officer and Chief of Staff at Grady Health System. And Dr. John DELZELL, Vice President of Medical Education and Incident Commander for Northeast Georgia Health System. So Dr. BRANSTETTER.
Thank you, Andy. Thank you all for allowing me to join you all today and share a brief update of what we're seeing on the front lines with COVID-19. 1 year ago, we came to you and discussed what we were seeing. What we were seeing is an enemy from without that we couldn't see, a virus affecting those who were older, who had comorbidities, chronic illnesses, and having devastating effects, hospitalization and death. Today that no longer holds true. The virus is no longer drawing that distinction. We're seeing far more young people affected by this virus, requiring hospitalization, suffering devastating injuries such as lifelong injuries to their lungs, as well as strokes and heart attacks. What we're seeing is the virus no longer makes a distinction based on illness, based on age, or even ethnicity. What we're seeing is the virus is drawing a distinction between those who have been vaccinated and who are unvaccinated. Our hospitals are once again filling up, and they're filling up with young people and old people and those with comorbidities who have not been vaccinated. Over 90%, 92% of our hospitalized patients are unvaccinated, including those in our ICUs. 60% of our ICU patients are those who are unvaccinated and have COVID-19. This is a huge numbers, and we're seeing this peak rise very, very quickly, rising to match or exceed the peaks we saw in the winter months of December and January. But there's hope. There's things that we can do as a community once again to come together to combat this enemy from without. This is not an enemy of vaccinated versus unvaccinated. This is an enemy of that we can't see any longer. We can't feel. We can't smell. But it is something we can do together. We can continue our fight to prevent this by doing all the safety measures that we've talked about, wearing our mask, watching our distance and washing our hands, staying home if we're ill, getting tested and screened if we've been exposed or have illnesses that are consistent with COVID-19. And we can get vaccinated. The vaccines have been proven safe and effective at reducing not only infection, but also if infected, and we're seeing that, but if infected, reducing the need for hospitalization and ICU stay. But the communities can continue to do other things to prevent and combat this surge that we're seeing within our hospitals. And those includes avoiding risk-taking behaviors, staying healthy, getting sleep, eating well, exercising, managing your chronic illnesses well. And certainly being mindful of the large gatherings, being mindful of those who may be more vulnerable in our society. So these things we can do to combat this enemy from without. I want to continue to encourage everyone today to listen to the message you're going to hear from my distinguished colleagues from 5 other institutions here. and I want to thank you for your time today.
Thank you. I'm Dr. Jim Fortenberry. I'm Chief Medical Officer at Children's Healthcare of Atlanta. And as you heard, we are seeing the same thing. At Children's Healthcare of Atlanta, during this surge of the Delta variant of the virus that causes COVID-19, we are seeing a significantly greater impact on our children and our teens. We're seeing more COVID-19 positive patients in our emergency departments, urgent care centers, and hospitals than at any time in the pandemic. Thankfully, only a small fraction of children with test positive for COVID-19 need to be hospitalized to treat their infection. But that doesn't mean that they don't experience illness and what can be significant illness and miss out on normal activities like school and sports. It's important to note for us that the combination of a more easily transmitted COVID-19 virus, together with an unusual summer surge of respiratory viruses such as RSV, is fueling high volumes in our emergency departments, our urgent cares, our hospital floors, and our ICUs. It's this combination of viruses that has had the greatest impact on children's overall volumes. With our network of 3 hospitals and outpatient centers and our incredible care teams, we've worked to manage the volumes, but a continued rise in numbers will continue to push our capabilities. Today we have 31 patients who are hospitalized, that is within our walls, across our 3 hospitals with COVID-19, and a large number of patients also with these other respiratory viruses. Our hospitals have very high volumes of kids right now across the board. The majority of kids with COVID-19 that I see in our hospital have underlying medical conditions like cancer, sickle cell, severe obesity, asthma, and they're having to fight this terrible virus in addition to the health challenges that they're already facing. But some of our kids are previously healthy that come in to need hospitalization. Many of our kids can't get the vaccine because of their ages, so we all play a role in preventing the spread to them. The best way to protect all of our kids is to get vaccinated. That includes any child 12 or greater and every one of us as adults. It is the way out of the pandemic right now. Now, while I understand parents may be concerned, it's important to know that COVID-19 infections do not necessarily require emergency or urgency care, nor does just a simple exposure. Children's has posted a helpful graphic on our website, choa.org, that explains when you should seek care from your pediatrician and when you should bring your child to the emergency room with a list of symptoms that can help guide you. In particular, if families are looking for a COVID-19 test for your child and they don't have any significant symptoms or only very mild ones, we strongly encourage parents to use a community testing site to avoid needing to wait in an emergency room or urgent care. You can find a list of testing locations also on show.org. In addition to vaccines, we continued to stick with the basics again. You heard the 3 W's: wash your hands, watch your distance, wear a mask. At Children's, we also believe kids learn best when they're in the classroom. The best way to keep kids healthy and in that classroom is to follow recommendations from the CDC and the American Academy of Pediatrics, which include indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. We owe it to our kids to do everything that we can to protect them.
Good morning. Thanks to everyone for joining us today. My fellow medical colleagues, members of the media, and those watching online. My name is SHARON, and I am the Chief Nurse Executive for Emory Healthcare. I've been a nurse for more than 40 years, and throughout my career, I have witnessed the dedication and the commitment shown by physicians, nurses, therapists, pharmacists, medical assistants, and many others in the healthcare field. This commitment has been demonstrated daily throughout the pandemic. However, it's being tested now in ways I have never seen before. We are seeing many nurses and clinicians, the strongest professionals I have ever known, leave the profession or paused their careers because of the stress of the pandemic has caused both personally and professionally. These subsequent decreases in staffing have directly correlated to our ability to provide access to care for the many patients and families who depend on us daily. Our nurses are the essential surveillance system for hospital care. They also stand by the bedside of our patients, comforting families and loved ones, and in many ways, nurses become the extended family members of those who seek care when they're hospitalized. We see and know firsthand accounts of our patients. We are elated when patients recover. We cheer them on, provide encouragement, and celebrate with them. We share knowledge with them. We also grieve when our patients and their families grieve. It impacts us when we cannot fulfill the full promises that we have to patients and families, and that's what hurts clinicians. The current COVID surge is affecting everyone who needs care. It has deeply impacted our frontline clinicians, including our nurses, because we know the spread of this virus is preventable. Unvaccinated COVID-19 patients are placing large strain on our hospitals here in Metro Atlanta. Patients without COVID-19 continue to be admitted. They require specialized care too, and some of them have long hospital stays. This combination is leading our already busy hospitals to have longer wait times in emergency departments and longer wait times just to get into a hospital bed. This trend is being seen throughout the nation. Our nurses and care teams are caring for all of these patients, both COVID and not, every day. Go with me for a moment inside the nurses' world. As nurses, we're expert clinicians and natural caregivers. We want to take care of every patient who crosses our path. However, this surge in COVID is making it difficult to provide the most critical care to those in need: the children, the immunocompromised, patients who need treatment for acute and chronic conditions, as well as those who are gravely ill with COVID-19 and the Delta variant. This takes an emotional toll on all the clinicians. Additionally, patients being treated for COVID are putting those in our care facilities, as well as those who work there, at risk both physically and emotionally. We need everyone to do their part by getting vaccinated. Vaccinations drastically reduce hospitalizations and severe illness. I want everyone to think for a minute of your loved ones, your children, your grandchildren, your spouse or significant other. I know you want the best for them, including access to the health care they need. If we're unable to curb the spread of COVID, accessible and critical care may be much harder to receive. Emory Healthcare's primary focus remains on our patients. Our teams are working tirelessly to care for all of our patients, supported by contract nurses and others in areas where we may have staffing challenges, just to increase this accessibility to care. We're grateful for all the clinicians and those who continue to support us in our efforts. We're also thankful for individuals in our communities who are taking proactive measures to stay safe and get vaccinated. Thank you.
I want to thank my colleagues, members of the media, and everybody watching at home. I'm Andy Jafal. I'm the Chief Medical Officer for Piedmont Atlanta Hospital. The reality is we expect this latest COVID-19 surge, driven by the highly infectious Delta variant, to significantly outpace the previous highest peak of COVID-19 infections. And it will get worse before it starts getting better. Some Piedmont hospitals have already seen higher numbers than they did in the past largest surge in January. Increasingly, we are now seeing younger patients in our hospitals. Those patients are getting sicker much sooner. They are on a ventilator much quicker. I watched a 28-year-old previously healthy unvaccinated patient die from COVID complications. And while we value every life, that one was tough because it could have been prevented. The massive influx of COVID-19 patients is straining Georgia health system resources, including nurses, beds, and ventilators. But here's the biggest problem and the saddest story. 96% of the patients we are seeing in our hospitals are unvaccinated. 97% of the patients in our ICU are unvaccinated. Considering the rapid spread of the COVID-19 infections across Georgia, vaccines work. Vaccines are the very best way you can protect yourself, your loved ones, and your family. Combined with other critical safety measures like masking, distancing, and hand washing, vaccines are the best tool to keep our communities safe. As dire as this situation may seem to be, there are steps we can all take to support our communities and make a difference. We need your help, the public's help. If you are eligible to get the vaccine, please do the right thing. Please get vaccinated. Do it for yourself, for your family, and for your community. If you are vaccinated, we say thank you. And please share your vaccination story with your colleagues and family members. And while we watch many more roll up their sleeves to help us move forward together, please continue to wear your mask, wash your hand, and watch your distance. Thank you.
Good morning. I'm Robert Jansen. I'm Chief Medical Officer at Grady Health System. This morning I was walking into work and I ran into one of my colleagues who's an emergency medicine physician. He had just finished his night shift. So I asked him how it was. And the story is so horrific. Our emergency room, like so many, are overrun right now. We have more patients in the emergency department waiting for care than at almost any other time. And this is seen at every hospital in the city and across the state. I know we're talking about COVID. So what is the COVID impact on this serious issue with emergency departments? Our emergency department, as you know, is the major trauma center. We're a major burn center and a major stroke center. Those patients don't stop coming in. They still come. Those patients who have been delaying care because of COVID are still coming in. Those patients with all the medical conditions that we see day in and day out, diabetes not controlled, heart failure, chronic lung disease, sickle cell anemia, those patients are still coming. Now we have the Delta wave, which is how I've come to think of it. This tsunami of patients coming to the emergency department who were infected with the Delta variant, layered upon already an incredibly busy emergency department. The result is that patients are waiting longer. They spend more time in the waiting room if they're not critically ill. And the result is that some patients who require admission spend time waiting for a bed upstairs in the emergency department because our beds are full. Our beds are full with those patients who normally come to Grady, and they are full now with COVID patients. We talk a lot about diversion and what that means to the community. So diversion is a term that we really use to communicate with EMS, giving them the status of our hospital. For the first time that I can remember, we are having to go on diversion not because of trauma cases, but because our emergency department is full with patients who were infected with COVID. Now, let me clear up a myth. Diversion doesn't mean you can't come. If you come to any hospital who is on diversion, you will still be seen and you will still be receiving the greatest care you can receive. But it's our way of communicating to the ambulances that we're full, and if you can find another place to go that can deliver care quicker, that would be a better option. But we never turn anyone down. We never turn a trauma patient down, a stroke patient down, a burn patient down, or anyone else who requires care. But the impact of COVID on those patients who need our care is significant. And as you've already heard, who are these patients who have COVID? They are primarily unvaccinated patients. They are people who have chosen, for whatever reason, to not get a vaccine that we all know is safe and effective. Our hospital is filling up with COVID patients, and they are not vaccinated. Very few patients who are vaccinated have required admission at our hospital or across any of these facilities. So what can we do? What can we do to make sure if you need emergency care, it's available? Get vaccinated. Take care of yourself. Do the things that we know help prevent the spread of this infection. It's the only way we can succeed, and we can do that. But it takes work, it takes effort, and it takes all of us to do that. This is real, and it is having an incredible impact on our community and those people who still need care who are not infected. Thank you.
Good morning. I'm Dr. John DELZELL. I'm Vice President of Medical Education and the Incident Commander for our COVID response at Northeast Georgia Health System. You've heard from our speakers here today about the number and the severity of cases that we're seeing and the high percentages of those patients who are unvaccinated. You've also heard that we're seeing younger patients who are sicker than ever before. And you've heard how this is impacting our healthcare workers, who were frankly already exhausted from fighting this pandemic. They're now facing a surge that's predicted to be worse than anything that we've seen before. Unfortunately, many more people in Georgia will get sick. And if you do, there are some things that you can do. If you've been exposed and you're having symptoms, we want people to quarantine. We want them to get tested when they can. We want them to follow the protocols of their employers and their schools and the places that they are involved with so that they will know what to do. They need to get care for things that need care for. One of the things that we've seen across the pandemic is that people delay care because they're scared or they're worried. The emergency rooms are full, but as you've heard, a lot of the illnesses like heart attacks, strokes, diabetes, those things haven't gone away just because of the pandemic. People still need to get in to get their care for those. If you're having symptoms, we want you to go to the doctor. We want you to go to the hospital. But remember, there are other things that we can do before we get sick to prevent and decrease the risk of COVID. You've heard it here, every one of us has said it. It's the 3 W's. Wear a mask, wash your hands, watch your distance. I think one of the things I would encourage you is if you can, avoid large gatherings. Don't go to places where there's a lot of people there. You know just by the percentages that there will be people there who are unvaccinated. There will be people there who are asymptomatic carriers of COVID, and your exposure to that is high. And finally, I'm just going to add my voice and that of Northeast Georgia Health System to the pleas of all of us here today. Go out and get vaccinated. If you haven't already been vaccinated, this is the time to do it. This vaccine's a new weapon against COVID since the last surge. The data and the research of millions and tens of millions of people who have gotten the vaccine says that it is safe for people to take. There aren't a lot of side effects. The risk is very minimal, and the upside benefit is enormous. The vaccine's available for anyone down to the age of 12, for all races and ethnicities, and what we've seen is lower levels of vaccination in younger people, and that's really contributing to those folks having a higher risk of getting COVID. The vaccine's free and it's easy to get, but if you wait until you get into the hospital and you have symptoms, it's been too late. We know that all of our health systems have the vaccine available. It's available at hundreds of pharmacies, the health departments, grocery stores, doctors' offices all across Georgia. If you aren't concerned about getting the vaccine to protect yourself, do it for the people around you. Do it for the people you love. Do it for your healthcare workers that are taking care of you. Do it for your communities. You can do this, and it will make a difference. Thank you.
Thank you to all of you. I'm going to ask a couple of questions, and then we're going to turn it over to media, other media for questions. Let me start with Dr. Fortenberry. Two questions. Do you expect with openings of schools across the state that you'll see even more patients with COVID, kids with COVID? And then tell us about the vaccine process for approval for kids under 12 years old.
Thank you. To the first question regarding the opening of schools and impact, we know and we expect that there will be some impact in opening up. What we also know is that school is critical for our kids. Those of you who have kids, grandkids, you know the impact on development, on intellectual development, on social development. And so it's critical that we do that. It's critical that we do that in the right way. And Children's recommends utilizing the CDC and AAP guidelines regarding school openings, which include the appropriate use of masking, encouragement of vaccine for those who are eligible to do so. So we continue to watch that. We have seen some impact, but we know that the benefit far outweighs the potential risk of doing so. Regarding the vaccine trials, there are active trials going on right now for children less than 12 years of age. We are very hopeful and encouraged that we will see some of those results and to move forward, and in fact, an encouragement to push forward with that emergency use authorization, as was done so effectively to help us when the vaccine was available for adults. So we wait to see, and while we're waiting, we know there's lots and lots of people that could benefit from the vaccine right now.
And one more question from me. Dr. Jansen, can you talk about the fact that it's predicted that our peak from this latest surge will not come until after Labor Day? So what type of plans does Grady and other hospitals have to contend with an even greater influx of patients?
So unfortunately, hope is not a plan, because we keep hoping that wave will start slowing down. But you're right. It's predicted that this Delta variant surge will not abate until late September, and we're hopefully and optimistic about that. So like all health systems, but at Grady, we have plans for being able to have patients in non-traditional areas if we need to admit them, and we've done this in the past. We can put people in areas that are normally used for waiting rooms and hallways, as well as, of course, continuing to board patients in the emergency department when necessary. You know, the unfortunate thing is that we don't have the luxury of saying we're full and we're closed. You know, we're not a hotel. So people will continue to come, and our staff will continue to cope, and we'll continue to find places to take care of these patients. But it is going to be difficult, and it's not going to be easy, and it won't make people happy. You know, if you require admission to a hospital, imagine that you don't have the luxury of going to a room. You spend extra time in the emergency department, and then you're put in a non-traditional place because we don't have any available rooms. But that's what we'll do. We will find space, we will find staff, and we will provide the care. And we have those plans. We had those plans after we had our flood in 2019, for those of you who may recall that. And we've just continued on with that plan as the COVID pandemic has surged. We have all the plans, contingency for where to put people, how to take care of them. We have adequate ventilators, adequate PPE, all those things that you need. But it's going to be hard, and it's going to be a dissatisfier to those people who come to the hospital who need care. But we'll take care of you, I promise.